It always takes me a little while to. Okay, can you see the presentation now? Okay, so what I'm going to do is run you through some statistics which are about what's been happening nationally, and then what's been happening in Hull. And basic information is available from the website that's up there. And I understand that Tasha's already downloaded the stuff relevant to Hull, so you're already on a good go on it. So I'll run through this. I'm sorry it's all numbers and stuff, but it's to give you an idea of some of the trends. So let's start with this graph here. What this is what's been happening with the number of social work assessments, where social workers at the end of the assessment said that a learning disability, a physical disability, or a mental health problem in the child was a factor in the assessment. So these are all children with either a disability or serious illness. And what you can see is that it's gone up from 69,000 to 123,000 in between 2015 and 2021. So this is the increase in the number of children where in any one year social workers did an assessment and they found one of those three things as part of the assessment. So we're counting children basically who've been assessed, and you can see it's a massive increase, 77% increase nationally. Some of that is because the total number of assessments has gone up. It went up by 20%. But even so, there's a change in the number of children who are assessed from 16.9% to 25% who had a factor which was a learning disability, a physical disability, or a mental illness. So that's a quarter of all assessments nationally. So it says what a big part in the assessment process these children with disabilities are playing. So I thought, well, what does that look like in Hull? By the way, this information is you're the first to be hearing it because it's from a Freedom of Information request that I did with Luke Clements. So Luke and I are working together on this. We've not published it anywhere yet, and it's the first time these early results are being presented. So what's happening in Hull is that you've more than doubled the numbers of children who were assessed and where disability or illness was part of that assessment. It's gone from 459 to 956 assessments in which a child with a disability was involved. And part of that might be here because there's been a general doubling of the number of assessments. So the net has been thrown a lot wider. But still, what it means is that disabled children are still about a quarter, 22.7% of all assessments are done on children with one of these factors. We don't know how well social workers are diagnosing them, but it's certainly an issue that they've chosen to record. So what I thought was, well, let's have a look at how then you compare with the national statistics. So here's the national statistics done as a rate per 10,000 children. So it goes up to 100, which is 1% of all children in that year across the country were assessed and found to have a disability. So that's just for 1 year. It's not the number with a disability. It's just in that 1 year. And there's Hull. Last year, 1 in 60 of all children, 1 in 60 of all children were assessed and found to have a disability in Hull. That's not a measure. I keep saying this. It's not a measure of how many disabled children there are. It's a measure of how many come into the system and get assessed. So England's seen a 70% raise in that rate. Assessments have increased by 20%. Hull, 100%, a doubling in that rate. And assessments have also gone up by 98%, but you're still about a quarter of all assessments. Now, what might this mean? What you would expect it to mean is that children with a disability, that you would have some increase in the numbers who were registered with a disability by the local authority, and some increase in the numbers who become in need, because all children with disability or illness are in need by definition of the Act, the Children Act. All these children should be being in need and getting services as children in need, should they require them. So you'd expect those numbers to go up. So this is showing the same period. So first thing you notice is that if we look at this bit here, is that although there's an increase in the numbers of children being assessed in England, there's no change in the numbers of children in need. But in fact, those children in need where the primary need is said to be disability or illness in England has fallen by 24%. So we've had a huge increase in the numbers of children where social workers have said at assessment there's a disability or illness, and a fall in the numbers of children in need, which I think is very worrying, because it says that maybe those children are being treated, as some of you have already said, as where the primary need is perhaps abuse or neglect. So the focus has changed. I can't answer that for you yet. I hope to do that. We're going to do another Freedom of Information request to get some more data on this. In England, the number of children with a recorded disability has fallen by 3%. So it's about the same. However, in Hull, what you've got is no change in the number of children in need, just as it is nationally, but a fall of 50%, a whacking fall in the numbers where the primary need is disability or illness. Now remember, there were 956 children assessed in that year where it said that there was a disability or illness, and you're looking at 170 who are in need because of disability or illness. So there's a massive discrepancy there. And similarly, where there's a disability has been recorded, there's been a 39% fall. So we've got these big increases in children being found at assessment to have a disability or illness, at least according to the social worker, and a fall in the number of children in need who are receiving services because of disability or illness. So quite worrying statistics. Let's summarize that. Large increase in assessments, a larger increase in assessments where a child's disability was a factor, no change in the numbers of children in need. Then you've got this number of children in need at 31st of March with a recorded disability didn't change in England, but fell by 39% in Hull. Numbers where the social worker said that the primary need that they were dealing with was a disability or illness has fallen by, I can't see the numbers there, fallen by something in England, by a lot more in Hull, by 50% in Hull. I can tell you how much it fell by. Fell by 24% in England and by twice as much in Hull. So finally, whilst disabled children, around a quarter of all children assessed in England and in Hull, there is a much lower and falling proportion of children in need where the primary need is disability. So there are a quarter of children assessed, but there are only 8% in England and 5% in Hull of children where the primary need is disability or illness. And where a disability is registered, it's also fallen 13% and 10%. So the 25% of assessments, but much less in terms of those that are getting a service because of disability. Does that make sense?
Yeah, it's quite worrying, isn't it?
Yeah. Well, the other bit that I decided to do was to look at, well, what are the general trends in child protection in England and Hull? Now, what we know is nationally, there's been a massive increase in the number of investigations. Over the last 10 years, it's gone up more than double. And what's really increased is the number of children who are investigated and found not to have been abused, or in other words, not put on a child protection plan. So what's happening in this same period with investigations in Hull? What you can see, or you might be able to see, because you can move where people are if you want to look at it, is that
I can see it clearly.
There's an increase of 19% over that period in England of child protection investigations. So it went from 138.5 per 10,000. That's 1.38% of children to 164, more than 1.5% of all children. But in Hull, it's gone from 274% per 10,000 up to 482 per 10,000. Now, 482 per 10,000 is nearly one in 20 children. So nearly 1 in 20 children last year alone were investigated in Hull, 3 times the national average. So huge issue, I think, for Hull to think about is why that is. Some of the difference may be because Hull is very much more deprived, and there does tend to be more investigations in deprived areas, so that some of that might be because of that. But I don't think that would account for all of it. I haven't been able to look at those figures, but I think it's well worth raising this. Now, people might say, well, that's a good thing, isn't it? Because what it means is we're really doing a lot of work to protect children. But let's have a look at the rates of children on child protection plans. What you can see is it's about steady in England, and in Hull it's gone up. It's gone up by 76%. So go back, both investigations and child protection plans have gone up by 76%. So you've got a huge number of children being put on child protection plans. We don't know the quality of that work, but what it does mean is that 2/3 of the children who were investigated in 2021 didn't go onto a child protection plan, because it was 482, it's dropped to 138. So that means that 340 per thousand, 3.4% of all children in Hull were investigated last year and not put on a child protection plan. Does that make sense? So that's the thing in numbers. So I'm sorry I've sort of dashed through that, but I'm happy to talk about it if there's any questions or thoughts on it.
I think